So our recommendation is really to shift the relationship between consumers and healthcare providers to one of much more of a coach-mentor on the health professional side and a consumer being an active manager, coordinator, decision-making in their own health services. The benefits for consumers, no question, is it empowers them to make the decisions that have the best fit for their particular values, health and wellness goals as individuals and as family members. Now, how do we do that? One of the things we have to do is work very carefully and closely with our health providers, both in our education system with the next generation of health professionals into what does a coach-mentor role look like and how do you empower consumers to manage their own health. Evidence is very clear. When consumers are directly involved in connecting to their health professional in a meaningful coach and mentor kinds of relationship, those consumers report much greater levels of health and wellness and much greater quality of life. So the outcomes are exceptional. Our challenge is to help get our Canadian system to that point. In our analysis of the OECD countries we are most often compared to, there were really 3 to 4 very clear findings that we could learn from as a country to strengthen our health system here in Canada. First and foremost is shifting our dominant acute care focus to a much more well-developed, comprehensive community care model that zeroes in on helping consumers and their families manage chronic illness, engage in prevention, and focus on health and wellness patient outcomes. Second thing is every country we looked at has 24/7, 24 hours a day, 7 days a week accountability among health providers to help consumers living in their communities manage health challenges or crises as they occur. That's something we think Canada really needs to look at. The third thing is, of course, we really need to start to think about how do we create financial models that support that transformational shift. And finally, what are the tools Canadians need to help get them to that point where they can make very good decisions based on best evidence, best approaches to health and wellness, help them be healthier and have a greater quality of life. We need to take our recommendation around how do we build a health system that's much more able to support and drive innovation as a way to achieve a sustainable healthcare system. We see fundamentally we have to change the way we think. We have to become much more entrepreneurial. We have to create resources in our health systems that can drive innovation using simple proof of concept testing. Create the evidence around what those outcomes are. If they're positive, how do we translate those outcomes to all jurisdictions so that all Canadians can benefit by them? How do we create the evidence so every jurisdiction in Canada can benefit by innovation, adoption, wherever that evidence might have been gathered or learned to help the entire country transform itself into a sustainable, productive healthcare system that really achieves population health and wellness outcomes that every Canadian can enjoy. As a centre, we've created this very interesting analysis of OECD comparator countries. We've learned some important lessons. Where do we go from here? As a centre, we need to be engaging Canadians across every jurisdiction to create the dialogue and create the momentum in terms of how do we learn from the evidence among these OECD countries that have achieved some very impressive outcomes and very interesting models of healthcare delivery. How do we consider those within the culture of Canadians' thinking and values around healthcare, and how do we then position that dialogue to affect change in our health systems with every jurisdiction, one agency at a time or one entire health system at a time, wherever that might work. So that's really where the next steps at the centre are driving, is to create the national dialogue and create the knowledge translation approaches so that every Canadian can benefit by these lessons learned.